Next, we're going to do our PICC dressing change. First, we want to get our area ready. We've got to select your work surface and clean it with a disinfectant cloth. You want to cover the surface with a paper cloth. Even foil will work. You're just protecting that area. You want to wash your hands, set up your supplies. After that, you're creating your sterile field. You open your supplies and place the sterile field, including the end cap and the stat lock package on there. Mask for both you and the patient should be used. The mask and the dressing kit change will always be on top. Next, you're going to remove the old dressing, and you can use non-sterile gloves to do so, and remove the dressing and the stat lock. You want to note the length of the catheter using the centimeter marks, and that's usually from where it connects at the stat lock to the insertion side of the patient. You're going to dispose of the old dressing and gloves, and next you want to inspect the catheter and the surrounding skin for signs and symptoms of infection, swelling, redness, draining fluid, or pus. Important, next you want to wash your hands again and don sterile gloves in preparation to replace the PICC dressing. And you want to use a gauze pad and hold up the catheter off the skin. You want to ensure that you are not pulling the catheter in and out of the patient. Using a chlorhexidine stick, you're going to scrub a 4 by 4 inch area around the insertion site for 30 seconds and allow to air dry. You don't want to blow on it or wave your hands. Next, you want to apply skin prep where you plan to place the stat lock and allow that to dry. The stat locks tend to stick very hard to the patient, and skin prep will help with that. Put your stat lock on, and then you're going to place your dressing covering the insertion site and the stat lock. You want to note the date and time and length of the line and mark that on the dressing, and you are complete. In this video demonstration, you'll notice the nurse has set up the patient's arm and on a comfortable area, and now he's getting his PICC kit, his cap change, and sterile gloves, as well as a stat lock kit. And next he's going to start removing the dressing using alcohol swab or a wipe. Either one will work. And that's to prevent skin damage to the patient, and works well. Most of the tegaderms after being on a week come off fairly easily. You'll notice in this dressing there is a bio patch, and at our facility we do not use the bio patch, and there's actually evidence showing that the bio patches can be counterproductive as far as infection goes. When you get your dressing off, you'll notice that this is a very good time to measure from the insertion site to the stat lock, and this will tell you where the PICC is located in the patient, and you'll see centimeter marks where the arrow's at. You want to unclip your stat lock, and the stat lock is also removed. And this often sticks very hard to the patient, so go slow, use your alcohol, and take that off. Next, you're going to wash your hands, and you're going to put on sterile gloves. And this is in preparation for cleaning the site. If there's any loose material, blood, or anything, this is a good time to use an alcohol wipe and get that out of there. And then you want to use your chlorhexidine scrub for at least 30 seconds. And you don't have to wash in to out, you're just scrubbing the area. You want to lift up your line using a sterile gauze. You can flip it over, wash that part of the line. You generally want to do about a 4x4 area, so 2 inches on each side. At all times, maintain the PICC line from pulling in and out of the insertion site. Once you have the insertion site cleaned and you've let it dry for 30 seconds, you're going to apply skin prep. And this is where your stat lock is going to be placed. Notice he's holding the line with a sterile gauze, and he is putting the stat lock in and locking it in place before putting it on the arm, which is problematic if you do it in reverse order. And as a reminder, we do not use the bio patches. Now you're ready to apply your Tegaderm, and when you do, you want to cover the insertion site as well as the stat lock. Once you have that in place, you want to ensure you date, initial, and I like to put the length of the centimeters onto the dressing also, so the next person that comes in can see what you started out with. And that completes your dressing change. Next, we're going to change the cap. After you've placed your dressing on, you want to change the cap out. You want to open and attach a cap to a saline flush, ensuring you don't touch the end of the cap. And remove the air from the flush in the cap, the new one, and clamp the line, remove the old cap. Using an alcohol wipe, clean the end of the line for 30 seconds and allow to air dry. 60 twists would probably get you very close to your 30 seconds. You want to place the new cap onto the line, open the clamp, and flush using push pause. Next, you want to scrub the new hub for 15 seconds and flush it with heparin. And your dressing change and cap change are complete. In our facility, we already have our sterile field set up because we changed the caps at the same time as the dressings. First, you want to get a syringe, saline syringe, and hook up your cap to it. Make sure the air is out of it. You're going to open your package. And leave the cap in the package. Hook up your syringe. And then you're just going to set that aside. On your patient, you're going to take an alcohol wipe and you're going to scrub the junction of the cap and the line for 30 seconds. When that is complete, you're going to get ready to remove the cap. Twist left and remove your cap. Next, you want to take another alcohol wipe and scrub the outside of the line. You're not scrubbing inside, just the outside. And this is also for 30 seconds. After that, you're going to connect your new cap. After your cap's connected, you want to run in your saline. In our facility, since we use sash, we're going to run in the saline, and after that we're going to disconnect, scrub the hub, and run in 5 mils of heparin, and that will complete the cap change.